With me now is Andy Walker, who's from Our Life. Our Life is an organisation that campaigns for the well-being and health of all of us here in the North West. Welcome to Channel M today. Andy, I know this isn't your research or your statistics, but are we not already telling people what they already know, that if you drink too much, it's bad for you?
I think the issue here is the real effects of alcohol-related harm in the North West, and those figures are quite stark. 3,800 people in the next year will die as a result of alcohol-related harm. 38,000, obviously simple extrapolation over 10 years. And we're actually looking at some of the national figures, and it's a serious situation. I think what we're saying is this should be yet another wake-up call alongside a series of wake-up calls that we've had in this region in particular, which is one of the worst for alcohol-related harm in the country. And really what we're saying here is that we need to take a real sort of look at this and do something about it. But
the British Beer and Pub Association say alcohol consumption is falling at its fastest for 6 decades. The steepest drop since 1948 when it fell by 11%. We've had a fall of 8% last year.
I think we can do all sorts of things with statistics, but...
Well, your statistics are telling us 38,000 people are going to die in the next 10 years.
But is that not a serious enough sort of issue and a statistic for us to take cognizance of? I mean, we're talking there about people who will die, who would not otherwise die. And if we then look at the 70,000 crimes that exist as a result of alcohol issues, we do have, you know, a serious issue here that we do need to address.
I think whilst I agree it's a serious statistic, you have the problem, do you not, of relating it to individuals and saying, it might happen to me. Nobody thinks they're going to be a victim of crime, in a car crash, die of smoking-related diseases. It's a scary statistic, but it doesn't relate one-to-one to the individual.
It's a scary statistic, but these are statistics that are real, and it is affecting people's lives, it's affecting their health service. Extra money is having to be spent on hospital care, on inpatient and outpatient care as a result of alcohol harm. And therefore, you know, these may well be statistics, but at the end of every statistic, there is a human story, there is a human cost. And it was interesting just looking at the, you know, your segue into your story here of an apparently ordinary person just keeping a drinks diary. And a lot of people don't realise sometimes how much they actually do drink. And why is that? It's because of the messages that we're bombarded with on a regular basis. And it's not just pubs. The supermarkets have got a role to play here as well.
So if it is about medical harm and social harm of alcohol, then it is about reducing our intake. Is cost and finance and the control of the price of alcohol the way to go?
All the statistics that have been carried out, all the surveys that have been carried out on this issue would indicate that there is a direct link between overconsumption and cost. And there's a lot of discussion going on at the moment. There was meetings taking place of health professionals today in Manchester to look at whether or not there should be a minimum price for alcohol. And it's worth pointing out that if there was such a thing, then you would be looking at a minimum price for a pint of beer of £1.50. That's how much a pint of beer would cost minimum. Now, most pubs and clubs are selling pints of beer for way above that, so it wouldn't really affect the pub and beer organisations.
You must be disappointed, then, with the announcement today by the Department of Health that that's not the route the government's going to follow.
Well, I think, you know, the government can make all sorts of announcements and...
Well, it's a fairly strong announcement. The government has decided not to proceed with any national or local measures around minimum unit price.
Well, I think, you know, obviously that is disappointing when we would say that there is a direct link between cost and consumption. However, you know, we don't think that that's the last word on that. We believe that there is sufficient concern within the North West in particular, but obviously around the country as well, to hopefully get the government to look again at that.
Andy, thanks very much indeed for your time.